really need to get together and let our voices be heard.
This is Buffalo What's Next. I'm Jay Moran.
I'm Bridget Jaipal Valenza.
I'm Dave Debo.
And I'm Thomas O'Neill White.
After May 14th, how can we afford not to talk about race?
About education, about segregation, about humanity.
Since the dawn of this nation, racial violence has existed. The way we have designed our society has a big hand in what occurred in that Tops Market.
The suburban area, everywhere, we must work and teach our children.
We need to make sure that we put more funding in our programs that help prevent gun violence and more money into art.
If we're going to have some real healing, we've got to have space to tell some uncomfortable truths.
And this is Dave Debo. Today is Black Women Equal Pay Day. A lot of organizations use this as a way to bring attention to the problem. One of those groups is the National Women's Law Center, and Jasmine Tucker, their Director of Research, is here with us. Jasmine, thanks for being here.
Thanks for having me.
Talk a little bit, if you can, about the scope of the problem. What is the disparity here?
Yeah, great question. Right, I think we know that there's sort of a long-standing history of discrimination for Black workers in our U.S. workforce, sort of even as they helped build America and provided the foundations for our economy. But even today, it takes Black workers longer to find jobs, and when they do, they're paid less than their white peers. And so what we see is that this pay gap is especially large for Black women who not only face race discrimination in the workforce, but also sex discrimination. So when we look at Black women who are working full-time year-round, they're paid just 67 cents on the dollar paid to every white non-Hispanic man. And, you know, these gaps, they really add up. You think it's just pennies on the dollar that they're losing, but this costs Black women, you know, almost $1,900 a month, almost $23,000 a year, or over $900,000 over the course of a 40-year career. So this has really huge impacts for not only Black women, but their families and their communities.
And the reason it's observed today is today, here we are, September 21st, is the day that they have to work to in order to achieve equity?
Yeah. So when we look at all workers, so not just those who are working full-time year-round, and it's sort of important to look at this sort of other definition of the wage gap because of what happened in 2020 and the effects of which we're still, feeling in 2021 and still now in 2022. As we're moving to recovery, there were still, a lot of job loss, and especially among the low-paid jobs that Black women are overrepresented in 2020, right? And we were we're still recovering in 2021, and that's the most recent data that we have right now. So today is the day that Black women have to work to make what white men made last year alone. So it's the day that they catch up.
So this is the entire past year and then till now just to catch up.
Correct. They have to work an additional 264 days, I think it is.
That's almost an entire year.
Mm-hmm.
This is a situation that I'm sure you're bringing to attention because you want people to address it and change it. Let's talk for a minute, and we will dig further into the problem, but let's talk for a minute about how that could come about. Is it a matter of just pressuring employers and saying, this is not right?
I think that's one piece of it. I think what we're looking at is a multi-pronged approach here, right? We definitely need to pass laws both at the state and federal level that does require, that employers are actually doing the thing that we need them to do, which is to pay, Black women and other women of color what they're paying their white male counterparts. And, it's not a matter of like Black women choosing certain kinds of jobs. They are overrepresented in the low paid workforce, but there are other sort of things at play there, right? What we see is that there's a wage gap in 94% of occupations. Even if they're choosing a high-paid job, a low-paid job, like we're still seeing that Black women are overrepresented. And, in the pandemic, we have seen Black women more likely than any other group to be on the front lines of the pandemic, continuing to provide childcare, grocery store services, like all of these essential services. And even in those jobs, we saw Black women were paid less. So I think we definitely need to be doing more to hold employers accountable for that equal pay. But there are other things that I think we could do as well. Employers could sort of step back and get out of employees' way. I think right now we're seeing a lot of people resistant to go back to February 2020, where the economy really wasn't working for a lot of folks, and especially Black women in these sort of underpaid and undervalued roles that they've continued to work in throughout the pandemic, providing essential services, right? And so we've seen a lot of movement on the unionizing front, and collective bargaining is a great way for workers to sort of bind together and bargain for better pay, for more benefits, right? We're 2.5 years into the pandemic, and we still don't have guaranteed paid leave. So these workers, right, if they get sick or their kids get sick, or right, and they need to take time out of the workforce to provide that care, and we're seeing, right, that's disproportionately falling to women. They're not able to do that and have a guaranteed job when they're no longer providing that care. So there's things that we need to do, like provide guaranteed paid leave for those folks. We need to make sure that we are investing in childcare, like it's actually infrastructure. People are not able to go to work without, providing care. They can't get to work without a road to get to to their workplace. They can't go to work without a safe place for their children to go. And this wage gap means that Black women are even less able than, white women or other women to afford that care because their wages are lower. And this is a really tricky one because we're simultaneously asking, parents to pay an arm and a leg for the care and underpaying, the very female-dominated child care workforce. So this is sort of a myth.
You're looking for some policy changes in addition to, forgive me for putting it this way, for poking or badgering the employers.
Yes. I think that we're going to need some policies, some laws in place that's going to hold those employers accountable, and they will have, right, if they are breaking the law and not paying employees equally, then there's some course of action. There's legal action that folks can take, and that often does mean something to employers. They don't want to lose, all of the legal fees and whatnot that they would have to pay. They want to be compliant with the law. So I do think that would go a long way to help.
You've just brought up the next thing I was going to ask you about, and this is really more for discussion than it is me just being naive. But isn't there a law against this sort of thing? You said earlier that among full-time year-round workers, Black women typically make 67 cents for every dollar paid to white non-Hispanic men. Isn't that illegal? Aren't there anti-discrimination laws? I guess what I'm asking, and this is maybe where the naivete comes in, if these laws are on the books, why does this situation still exist?
Right. I think, so what we do need is like an equal pay law that is like at the federal level. There's lots of states that have equal pay laws like this, but not every state, right? We need something like the Paycheck Fairness Act, which is going to sort of be the law of the federal land and ensure that there will be less of this. I think there will always be a little bit, of this happening, and I think employers will explain away some of the issues or discrepancies that we see in some way, and I think. But that doesn't mean that we shouldn't still try to put something in place that will close this gap, right? I mean, 67 cents is not enough. And there's a lot that we can do to get it closer to parity, and we have to do it.
And is it a matter, as you mentioned earlier, of just litigate?
Well, like I said, I think we need this multi-pronged approach. I think we've talked a little bit about companies or employers doing stuff. I think in 2020 there was a lot, right? There was this sort of racial reckoning where I think some folks who had never sort of faced it before sort of realized their role, and a lot of employers, right, were doing some performing on their social media platforms and other platforms and saying, Black Lives Matter, and that was important to do. But I think what we really needed them to do was to look at how they're paying their workers and seeing if there are disparities by race, by gender, in the same roles. We needed to see Black workers and Black women in particular, put in management roles, put in positions, C-suite positions that are not just diversity, equity, and inclusion positions, right? We need to see those employers put their money where their mouth is, right? And create workplaces that are being led by Black women. So, right, if white men continue to sort of be in the C-suite and to manage these workplaces, they're never going to be friendly enough for women and for women of color who are bearing the brunt of this pandemic and who are more likely to be breadwinners than white women. The workplace is never going to work for them. And so we need to put Black women in positions of power within these organizations so that they can bring about some change that is so desperately needed for those who are not in the C-suite.
I had never thought of it until you mentioned it, but Black Lives Matter penetrated society. It was something that I think the George Floyd knee on the neck was in everyone's living room. They couldn't avoid it. But at the same time, its focus was primarily police brutality. It didn't necessarily spark a broader discussion on all the other equity issues, this one included.
Right. And, the defund the police is definitely a big piece of the puzzle here, right? We are policing Black folks at a disproportionate rate, and that takes away income from Black families, that takes away income for those communities. We're losing so much by doing this policing and by not addressing mental health issues or other issues, right? People are in poverty, right? Like these are social issues that we need to be fixing by investing in people and not in the police and policing them. But you're hitting sort of the nail on the head there, is that there are tons of ways that we can do this, and right, centering Black women in this recovery. I feel like the pandemic and this racial reckoning have really laid bare a lot of the sort of structural and systemic inequities that we have in the economy, that we have in the workplace, that we have in all of these systems that are around us. And if we are not going to fix them now when they are so clear to us, when are we going to fix them?
Jasmine Tucker is with us. She's the Director of Research for the National Women's Law Center. She's here on a day that is called Black Women Equal Pay Day. Earlier in the program, you probably heard her mention that this is the day that Black women have to work to in order to have the same amount in their wallet today as white men made basically the entire year last year. So it's the entire year plus this amount of time all the way here until September. Jasmine, we've been sort of talking a little bit about COVID around the edges. Let's really dive into it. That if the pay inequity is a killer blow, COVID certainly did not help.
That's true. I think that they're right. So we know that Black women have been on the front lines of this pandemic more than any other group. So they've continued to provide these essential services and have been paid less than their white male counterparts in doing that. But what this pandemic really did was left them less able. Black women were less able because of the less money in their pocket. They have been less able to weather the economic fallout of the pandemic. So we've already talked about how Black women are overrepresented in these low-paid jobs, which we saw were totally devastated in 2020, right? We saw retail, we saw leisure and hospitality, the child care workforce. We saw all of these job losses in these low-paid in these low-paid jobs. And I think that there is sort of this myth that, recessions are temporary. They're right. There's a finite period of time that recession is happening, and so unemployment rates come down and everyone's fine again. And that's not true, right? There are so many Black women who are still struggling and who had to dig into savings, who had to make really hard choices about what they could afford. We're still seeing, Black women have lost employment income in the last month. They still don't have enough food to eat. They're behind on their rent or mortgage, right? We're seeing this sort of ongoing problem, but what we're seeing sort of in the news is that unemployment rates are down and jobs are up, and so everything is good.
But
that's not actually the case.
That doesn't take into account what's called the labor participation rate. The idea that some people just have given up. They're no longer in the job market.
That is true. We have not seen, I think, for a lot of groups, the labor force participation rate come back. So people who are in the labor force are either working or they're looking for work. And so what we've seen, sort of in the historical data is that Black women's labor force participation rate has been much higher than for other women, right? They don't have a choice. There's not enough, or, they need to work. Families are very reliant on those earnings. Black women are more likely than any other group to be breadwinners in their family, and so those families need that money. And so when Black women lost these jobs in the pandemic, that means, for however many months or weeks or, even years, because some of those jobs never came back. Childcare businesses shuttered completely. There were other businesses, restaurants. I feel like everyone knows the story about their favorite restaurant, near them that closed and hasn't reopened and has no plans to reopen at this point. So some of those jobs that these Black women were in are, have not come back, are not going to come back. And you're right, some of them have completely left the labor force, and we're still looking to see if those labor force participation rates are going to rebound. But that is part of why unemployment rates have come down, because these people have completely left the labor force entirely. So that does bring unemployment rates sort of artificially down.
Part-time wages certainly pay less than full-time. Are there any numbers to support the idea that maybe some of this wage gap is full-timers who left during the pandemic and now can only find part-time work? Is there data to support that, or is that sort of anecdotal?
No, it's not anecdotal. So we have looked at both full-time year-round workers and then all workers, because you're touching on all the key points. There were people there were many fewer people in 2020 and 2021 who were working full-time year-round than in previous years, right? Because they lost a job for any period of time. They were forced into part-time work, like you're saying, because of slack business conditions. So maybe in February 2020, they were working 40 hours a week. They lost their job, in March or April. And then, in July or August, they were brought back, but only at half time. So there was a lot of that happening and continues to happen. And so when we look at all workers, regardless of how many hours or weeks that they worked, Black women were paid about 64 cents for every dollar paid to white non-Hispanic men. So the gap is a little bit wider when we look at everyone.
The genesis of this program was the shooting in Buffalo on May 14th. But as we've started to broaden it and talk more generally about racial equity, we've started to look at neighborhood equity. It's a segment we're going to be doing in just a little bit here. The idea that the area where the shooting occurred hasn't seen the investment. And a lot of people who talk about that use the term generational wealth. I want to take that concept and put it in the context of our discussion here. This wage gap we're talking about, does it contribute to a lack of generational wealth? If a woman is being paid less over time, what does that mean for her overall earning during a career?
Right. So unequal pay does absolutely mean more than just Black women having less money to cover their current expenses, right? At a moment where we know that every penny counts. It has these sort of ripple effects that mean that Black women are missing key opportunities throughout their lifetime to build wealth, to build future economic security for themselves or their family, right? It means that This wage gap means that she can't afford enough to save for a down payment on a home. She can't afford to pay, to go back to school for her, for herself or for her child. She can't start a business. She can't save for retirement. And so, when combined with these other structural inequities, it really is no surprise that white families have so much more wealth than black families do. Because black women are sort of more likely than any other group of women to be breadwinners. Black families are so reliant on those earnings, and so seeing them be paid less than their white male counterparts just because they are black women is, frankly insulting. We are in 2022. 67 cents on the dollar is simply not enough, and these families cannot afford to wait.
The number I've seen in one of your reports, and it was a little shocking to me because it's such a large number, the wage gap will typically cost a black woman over $900,000 over a lifetime of work. And obviously that would end up contributing to the racial wealth gap.
Mm-hmm.
That's a bigger number than I think anyone could have imagined, no?
Yes, it is. Think about what you could have done with that money. And so if a black woman wants to catch up, if she wants to recoup that $900,000, she's going to have to work until she's almost 80 years old. And black women right now only have a life expectancy of 75 years. So that means that she's going to have to work until past her life expectancy to catch up.
Is there any reason for hope as you crunch these numbers, as you look at this? Give me the historical trend line. Are things getting better or are they getting worse?
That's an interesting question. So I think pre-pandemic, we had not seen any meaningful change in the wage gap for decades for black women. It's always sort of hovered in the mid 60 cent, in that range. We had not seen any meaningful progress. Right now, we have data that is frankly weird, right? So it's the same data sets that we're looking at, but 2020 had the loss of all of these low-paid jobs, which means that our full-time year-round number, so the 67-cent number that we talk about, black women making on for every dollar that white men make, those numbers those numbers show a sort of closure, right? We're seeing some progress, but because what happened in 2020 left so many high-paid workers in the workforce continuing to work full-time year-round, and many low-paid workers sort of out of this calculation entirely, we're seeing, I think, it's sort of an artificial closure. So we're seeing some progress here, but we don't know, and I think we won't know for a couple of more years, whether this is actually progress that is sustainable and we're going to continue to see more progress made. So I think, 2021 and maybe even in 2022, we're still seeing, right, some of these effects of people out of the labor force, some of these effects where people are underemployed. So I think it might take a while for us to really see whether this is meaningful change.
So it's a 2 steps forward, 1 step back kind of scenario with COVID maybe even being 3 steps back?
I think that's right.
Okay. Talk a little bit about underemployment if you can. Would a booming, thriving, massively productive economy mean more jobs and address this issue? Or is there still something sociological, attitudinal, that has an employer paying a black woman yet less?
That's a lot to unpack there.
And we only have about 10 more minutes left.
Right.
I always save the tough questions to the end. But seriously.
Yeah. Well, so we are still seeing, let's start with this sort of underemployment piece. We are still seeing women, working part-time involuntarily. So about 18.6 million women are working part-time, and over 1 in 10 are doing so for economic reasons. So there's slack business conditions, they want more hours, but they can't get them. So this is happening, and it's happening for about 16.2% of black women. So this is definitely something at play here. And I think some of this, right, is part of some of this that's happening is that there's inadequate access to childcare and other supports for people who are providing care for family members. And so I think that is something that we've seen. And we've seen, women with caregiving responsibilities have disproportionately shifted from full-time to part-time work during the pandemic to provide for that care. So I think that's definitely something that's at play here. On top of that, we've seen lots of unemployed women who've been out of work for 6 months or longer, right? So coming back to this piece that there is no work for some people who want it. And that includes 27.7% of unemployed Black women have been looking for work for 6 months or longer. So I think these are sort of huge issues. And I think, potentially there's something about not wanting to, this resistance to going back to how people were being treated in February 2020. Think about servers who are getting paid $2, they're only guaranteed $2.13 in many states. And then plus tips. And to be sexually harassed and to not have worker protections, to not have paid time off when you need it, I think that there are some people who are reluctant to go back to some of those jobs. I think that Black women in particular, because they are more likely than any other group to be breadwinners and to have families who are very dependent on that income, have not had a lot of those so-called choices, right? So they have to go to work. So whether it's, at the same job that they left, or whether it's slightly better, or if it's even worse than they left in February 2020, they have to put food on the table. They don't have savings. We have robbed them of, tens of thousands of dollars every year. They do not have the savings to weather this storm and to hold out for a better job, for a better paying job, a job with protections, a job with the union, a job, right? I mean, any number of things. So I think that, it's sort of a self-fulfilling prophecy in a way. They have to go to work. And if there's only one job that's being offered and they need that money, they need to catch up on their rent, right? There's no more rental assistance. There's no more mortgage assistance. There's no more stimulus checks. There's no more, advanced child tax credit payments. All of these really critical sources of income that we provided people in the pandemic that is not over, contrary to someone's belief.
Recent comments on 60 Minutes, by the president.
The pandemic is not over, and people are still struggling, and Black women are, they have borne the brunt of this, and they are still in a crisis, and we need to close the wage gap.
How much of what you've been discussing here is because of race? You keep framing it as Black women. I imagine that if we look at women in general, the amount they make is obviously different than the amount men make. Is the gap, apart from the situational stuff that you've already discussed, is the gap bigger for women? And I'll be blunt, is it racism?
It's racism. It's 100% racism. Black women, I think, are some of the most disrespected women in this country. They are underpaid. They are undervalued. They face race discrimination. They face sex discrimination, not only in the workplace, but, in any of these systems and structures that we have in place, right? They are setting them up to fail. Right? I think we've seen over and over, Black families have higher interest rates when they take mortgages out. They have, there's all of these things that are pitted against them. And so I think Black women have sort of this intersection, this horrifying, combination of both racism and sexism. And that is definitely what's there's nothing else that accounts for this. We already talked about how there's a wage gap in 94% of occupations. So we know that there's sexism at play. White women make a lot more than Black women. We've seen it in the data over and over. It doesn't matter what job they're in, it's consistent. So there's definitely racism at play on top of the sexism that women are facing.
Jasmine, thanks so much for your time.
Yeah, thank you for having me.
Jasmine Tucker is the research director at the National Women's Law Center. They are one of the sponsors of Black Women Equal Pay Day. Today is that day. Before I let you go, Jasmine, how do people get more information?
You can go to our website at nwlc.org.
All right, very good. Thanks so much for your time.
Thanks for having me.
Coming up, we look at land use in and around Jefferson Avenue. Jolanda Hill and Jerome Wright are standing by. This is Buffalo What's Next on WBFO.
Get all the trusted local news you need right to your inbox each weekday morning with the WBFO daily email. Visit WBFO.org to sign up today.
This is Buffalo What's Next, where we have conversations with the community about moving forward. To have your voice heard, press the Talk to Us button on the WBFO app, and we'll work to get your questions and comments on the air. Join us on Twitter at WBFO or email us at news@WBFO.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
And welcome to Buffalo What's Next. With us this morning, we have Stan Martin from the Buffalo office director, as a matter of fact, of CAI Global. We'll get more into that topic or that title in just a second. And Ebony White from the Buffalo Center for Health Equity and also with the Health Disparities Task Force. Good morning to you.
Good morning.
Good morning.
And thank you for joining us. As Stan, CAI was a sponsor of the Igniting Hope Conference at the UB Med School. There was a lot of different elements involved in it, but the idea is what? To connect the community into better health and wellness.
Absolutely, absolutely. CAI, we're a proud sponsor of the Igniting Hope Conference. We actually partner with the Buffalo Center of Health Equity as well as the African American Health Equity Task Force, to really bring an initiative called REACH, Racial and Ethnic Approaches Towards Community Health, to the city of Buffalo, really addressing chronic disease and improving the health and wellness, of our community. So it was a great opportunity to really further build awareness and education here in terms of addressing some of the gaps that we saw in terms of healthcare and in terms of community clinical linkages to get the word out.
And Ebony, of course, your group has been focusing on these health inequities that we see in the community. Can you just outline some of the things? These are conversations we've had previously, but I think they're conversations that need to keep happening. What are some of the top issues when we talk about health inequities in our community?
So for us, our focus has been around housing, food and nutrition options. Also, COVID, that has been on our main focus for many years now. And also the healthcare delivery system. So we look at a lot of those things and overall the social determinants of health. Everything that impacts you from where you work, where you play, if you don't have the option, the options to work or where you get your education. So we're looking at everything holistically, everything that impacts someone of having what we would call a high quality, right? High quality life and access.
And there's some real stark numbers available when it comes to if you live in some zip codes in the city of Buffalo, just can you go through just when it comes to mortality? The difference that we see? The
differences are those who live in particular zip codes. So if I was to say 14215, 14208, 14211, 14212, just to name a few, you're likely to develop some of these chronic diseases and other comorbidities and live less than your counterparts that live in different zip codes by like 10 plus years. That's stark that you can see in data and look at the trends of that something is saying because I live in a particular place, I have lack of access to particular things that are important to a quality of life, that my life will end much sooner than someone that lives in a different zip code.
And Stan, you were originally from Buffalo. You've come back to open this office for CAI. I know you've been here for a couple of years now. Right. So talk about what you've learned since you've come back.
Yes, great question. One of the things that I learned since I came back, and I actually knew before I left,
hasn't changed that much.
Hasn't changed that much, but in all seriousness, like Buffalo is strong. Oftentimes, we don't hear about the great things that are happening, in our city. And in terms of healthcare and in terms of healthcare services, we oftentimes have focused on a narrative that blames and shames the community. And one of the things that we're very, very vested in is changing that narrative and amplifying the youth voices, and as we like to say, promoting what's strong and not what's wrong. So building on the assets, building relationships, with the faith community, building relationships, with community residents who have that lived experience, who in some cases may have been left out of the conversation or didn't have a seat at the table or even a voice at the table. So what CAI and Reach does, Reach is a project of CAI, what we do is really amplify those voices so that the people are a part of the solution and not seen as a part of the problem.
That's interesting, that term that you use, blame and shame. People really feel that's a view inside these communities that they're being blamed for the problems that they have to endure.
Correct.
That's. Correct. I mean, can you expand on what they're seeing and what they're hearing about that?
The simplest way is someone said if they wanted more, they would do this or do that. So that's creating some level of shame for our community members. But if you don't have that as an option for you, so part of trauma, right? Trauma is eliminating choice. Many times our community lacks choice and options and say in these spaces. So that's where it becomes this blame and this shame, and that I have to live and be in the condition that I'm in always. And that's why it's so important and critical what CAI is doing, the Buffalo Center for Health Equity, and others in this space to give choice, to say that you are not the blame. This is infrastructure that was created systematically that impacts you, and you're not the cause, but you definitely will be a part of the solution to it, and that you play a major part in versus someone else doing it for you, but that we have what we need to do it for ourselves.
What about that then? So how do we make that change? This is something that's generations in making here in Buffalo, right? And probably in a lot of other cities across the United States as well. But you were talking about trying to change that narrative. What are some of the steps that you've seen that can help with that?
Number one is asking the community. We believe that the community, has the answer. So when you're talking about addressing, for example, food security, or when you're talking about addressing, the social determinants of health, instead of coming in with the program and saying we're going to do this for you, you need to come alongside and stand shoulder to shoulder, hip to hip, with individuals of that community and with residents, so that you can really see, the issues through their lens, and not from, from a position of, well, I'm from afar, or I sit high and I look down below, So therefore, that is a different perspective.
So trust sounds like this is a big issue here, right? I mean, that
Yes.
there just is a lack of trust with what the general medical healthcare system.
Yes. Lack of trust that they're heard, often or even seen. Do you really see me when I come in that room? I've spent extensive amounts of time talking with community members about that they are a consumer of a service, right? And you need to be seen, you need to be heard, and there's a way. And then talking to healthcare providers saying, did you hear this person when they shared these symptoms, or did you ignore them? And often, sometimes people leave feeling ignored in many of these spaces. So that's why building trust and just being a people of humility, right? Being able to connect just as humankind is really about having those conversations. If we have a disagreement, hey, I didn't like it, that doesn't mean they need to leave. You have to have some restorative practices, right? And I think we've started some of those restorative practices. And just with the conversations.
Yes, and if I could just lean in a little bit more on that, in terms of having those conversations, it's very important that we're providing access where those providers and healthcare providers and those interviewers, let me say, are from the community or look like others from that community.
Okay.
You may have heard the phrase, the messenger is just as important as a message. So one of the things that we try to do at Reach Buffalo is to really amplify the voices of the residents and also of physicians and providers of color. so that they are, having conversations. When I say they, the community is having conversations with someone who looks like them or someone who have a similar experience, a shared experience. So that helps to build that trust and rapport, with the community.
Let me follow up with a question, because I think we've heard about this before, but just to clarify, there is a shortage of people of color, though, who are providers of healthcare. Is that the case here?
That is the case.
And of course, recently a tragedy involved Dr. Daniels and his two daughters, of course, that took away a key member of the community in that regard, right?
Yes, a champion at the university in mentorship and supporting African Americans in getting into healthcare and being physicians. So that's hard because we don't have that, and you want to see that. You want to be able to see someone that looks like you, can communicate with you, and understands your culture, right? In that was a hard, that's still a very hard space for us, but we believe that he's planted so many seeds in our community and young people and youth that they will begin, we will start to see to fruition our leading future doctors, whether it's in pediatrics, whether it's in genetics, whether it's in all of the spaces, and come to fruition, because he did such great work here.
Yeah. Yes, and I just wanted to add, Jay, that when we're talking about inequities and we're talking about the social determinants of health, we have to really acknowledge that not only do some communities people need more, all right, just due to having access or where they start in life, place matters, but also the playing field, the foundation, the community itself, or the environment, I should say, the built environment, is not level. So therefore, those issues have to be addressed as well. So that's not just on the individual; it's also systems, that also need to be, addressed, so that you're able to promote equity.
Well, let's talk about this for just a moment. The Health Disparities Task Force has been together for some time. Your office, Stan, has been here for 3 years. Is there more that we still need to know that before, like you said, leveling the playing surface, finding these solutions? Are we still in that gathering phase of trying to really understand the problem? Is there more that needs to be dug into?
I think it is always more. But I will say we have not just been gathering without solutions, right? So the task force has been together well over 5 years now. And it was crucial. We didn't know that when we were coming together in a collaborative approach to address so many things, that it would be critical that we had some legs, right? So when COVID came, we had some legs.
Right.
We had some relationships. We had the conversations, the hard talks. We had to get to the place where it's say, hey, this is what I'm good at, this is where your strong suit, and we came together to really support and address COVID in our very own community, even with the food and the PPE and the access and the vaccination and all of those things. So we were ahead, if you will. We didn't know we were going to be ahead in COVID.
Right.
We just knew we needed to get together because we could not do it siloed apart. And the impact that it had when we did it apart, we kept missing. But it is always a conversation when you're looking at systems, right? You have to change full-fledged systems. You do a little repair here and then something else happens on this side, and it all impacts each other. So we have been doing that systematic change, definitely, by even starting with conversations and building trust.
Mm-hmm. And just one point of clarification, CAI, we actually started a program here in the city of Buffalo in 2015 called Hope Buffalo. It stands for Health, Opportunity, Prevention, and Education. And what the community said at the very onset, of our inception is that if we're going to address, the root causes of poverty. We got to address the social determinant health, in this community. So, and as a result of that great work, we've seen this ripple effect in terms of we are able to identify and bring in additional resources, to not only address teen pregnancy, but also chronic disease prevention. And now, as Ebony was speaking to, also was like COVID, increasing education and awareness about COVID vaccination.
So like you said, we've got to listen to the members of the community. They're going to give the answers when it comes to what is needed. On the other side of the coin, though, the providers, those systems where there is health, there are people who are accessing health care in Erie County, in different towns, and whatever the case may be. Perhaps maybe they might have a better means to access these things. But at the same time, right, I mean, is it doctor groups? Is it hospitals, health insurance companies? What's missing? I mean, are there gaps being allowed to exist here that still, like you said, conversations are ongoing? Can you help me kind of understand that a little bit more better?
So what I will say is the task force is comprised of all of those sectors that you mentioned, but there are still silos. So then you may have an insurance company in your space, but they still speak their language, right? So this is about translation.
That's a tough language.
Right, that's a tough language. And it's always about translation. So we have to translate what we need. I do believe that we all want our communities healthier. What does that look like, right? So someone is focusing more on the financial standpoint of it. Someone else is looking at, hey, what is missing in health-wise? Do we need another clinic, more physicians to meet the need and the demand of our community? But it has to be very consistent and ongoing, right? And if you look at all of the policies, and again, when you start looking at the infrastructure of it, you start to see where that will impact that. So we have to have conversations with groups that really weren't in our group before, right? So an insurance provider now might need to talk to a non-for-profit to say, well, when I develop this plan, how would this policy impact you when I put this rule into play? So I think we're starting to do it a little more than we did previously, but privy to that, during disrupt time, that put all of those places together. And then as just when it's time period, we see the value of putting all of these organizations together and them working collectively. But seeing how all of our policies may impact in a negative way the other organizations, whether it's in those social sectors too. But we're starting to have more conversations and more action where mental health is now looking at social determinants of health.
Right.
Versus I'm just looking at mental health. You can't look at people just singularly, You have to be able to see in the purview all of the things that will impact you. And social things impact us all. You can't get away from them.
Complicated for sure, and boy, a little daunting when you start describing it like that. Our guest this morning on Buffalo What's Next, Ebony White from the Buffalo Center for Health Equity and also with the Health Disparities Task Force, and Stan Martin, the director of the Buffalo office for CAI Global, sponsor of the Igniting Hope Conference recently held here in Buffalo. What about, and this is a difficult question, but we're talking about trust. May 14th happens. That couldn't have helped trust in the community. Any thoughts on that?
Let's see. May 14th happened and it disrupted trust, right? It disrupted it. What you are is like you were trying to build a good relationship, and it caught us all by surprise because here's the thing. No one thinks it could happen here.
No.
Right? We don't know it can happen here. We know we have some systems and some policies that are not fair, but we didn't think that would happen here. But it did, because it can happen anywhere. It can happen absolutely anywhere. But I think what has come out of that is you have seen great heart, great compassion, and people and allies standing with you and championing, not just for you or as a other, but collectively. Because when one doesn't do well, we all don't do well. It impacts us all. And it put us on a public spotlight of showing something is not well here. Something is happening in this very community that only has one grocery store, full-line grocery store. And it's been happening a long time. And who was missing? But I do want to acknowledge all of the pantries that were there well before, right? All of the churches, all the faith communities that were Tuesdays and Wednesdays that no one ever recognized had been doing it quietly, without publicity, serving the community, but we knew we needed so much more. So yeah, it was a hard hit for us, but it spotlighted what was already there.
Right, and one of the things I actually that day I was actually at a community meeting with faith leaders and community-based organizations and healthcare providers, and ironically, we were meeting to come up with ideas and strategies to how to prevent and stop violence in our community.
Yes.
Working with our most valuable parents and a few other community-based organizations that day. And as Ebony mentioned, it really amplified our efforts to partner to be more collaborative and not, competitive. And I also would say from a funding standpoint, in terms of our programs, the REACH program is funded by the Center of Disease Control, and then our Hope Buffalo program is funded by the Office of Population Affairs. So our funder wanted to pour in and lean into how can they assist in building that, restoring that trust, because many of our participants, attendees are from, from that area, and to have that resources made available to, to allow time to deal with the trauma, to allow time to heal, to rebuild that trust was very, invaluable.
CAI Global, that's the name, I guess it says it all, because you're not just here in Buffalo.
Correct.
You're in other communities as well. From what you've seen in those other communities, does it give you hope and maybe even a sense of certainty that solutions can be found here?
Absolutely. Actually, one of the things that we are actually our framework is surrounding community-based participatory approaches, and as a result of the success and the input and the outpour of resident community involvement, that is being replicated in other cities. So I would like to say selfishly that it started here in Buffalo. Along with the chicken wings, that is now in all seriousness, is being replicated and is transportable in other marginalized communities that have similar, if not greater, needs as well.
And you're seeing it play out statistically? I obviously mortality rates, that's something that takes a certain amount of time to really understand, but we're seeing it in other elements?
Yeah, we definitely utilize the science and the data, to help drive our decision-making and our programming. So we are seeing, advances. We are seeing, it make a significance. And actually, there was an article that was in the New York Times the other day that talked about how the increase in vaccination amongst African Americans, those who identify with the Black diaspora, was a direct result of some of the outreach that Ebony does and education from grassroots movements. So when you look at when, COVID,
because initially that vaccination was very
over
low,
2 years ago,
Yeah.
And now you've seen a spike, you've seen an increase in those areas in terms of uptick, and a lot of it is attributed to a lot of the work that Ebony has done here in Buffalo and other initiatives across the city, similar with, under the REACH umbrella.
Concrete, that's got to be a real boost, I would think, to see that type of concrete result.
Yes. We are not where we were 2 years ago, right? Even with the influx of COVID infections, we definitely have a reduction of hospitalization and death. Where we were 2 years ago, you just did not know people were dying just families, and that's why it was critical for me and people who do grassroots boots on the ground all the time to speak their language. Give them the information, never eliminate taking away choice from them, always having this open, normalizing conversation, making sure they're getting the facts, debunking a lot of the myths, and being available, and they know where to find you for future. You know, one of the biggest things is I remember we were going out and doing tabling, and we were masked up, and we were trying to share, you know, the message, hey, you know, here's a pop-up clinic, and this is where you can go, and we're coordinating these things, and everyone is just like running from you. And then you would see 4 or 5 months later, can you help me? I'm ready to go get my vaccine. I'm going.
Really?
My family is going. Because our pitch was do it for yourself, first of all. Do it for your family. And how, when you're doing it for your family, you're taking care of your community. And that was our constant. We never changed that because that's what it was about. And making sure people got the information that they needed when you gave them the info. So, you know, you're passing out palm cards and QR codes, and they're reading it. Don't take my word. Here you go.
Right.
Here it is. Evaluate it. And then you allow them, then we did the 3 A's, which reviewed, you know, to ask, advise, and then assist them. So when they were ready, that was the simplest way during those Thanksgiving conversations when people had to make hard choices about, can my family come over?
Right.
I can only have this many. Have you had your COVID test? Have you had your vaccine? Those were hard times. That was difficult to do for anybody. That was difficult to say, I'm accustomed to 30 people Christmas. It's just 4 of us.
Right.
We're on Zoom. You know,
Zoom Christmas.
We're on
Oh,
Zoom
my God.
Christmas and Thanksgiving and New Year's because we can't be together.
Yeah, I was just going to say, Ebony, during that time, it was during the epic, you know, during the height of the pandemic, you know, being able to work with the Buffalo Center of Health Equity, to be able to work with the University of Buffalo and many faith leaders to identify, you know, who are those that were directly and mostly impacted by it, and then to create a plan, you know, to make sure that, you know, people had access, you know, to not just vaccination, but also transportation, for food, you know, for health care, you know, even just to work. Because, you know, many of those who were on the front line were, you know, those are people of color.
Right.
So, you know, how do we, you know, really address the basic needs of everyone in the community in a comprehensive manner? And I think that's one of the beauty of having these partnerships, being able to be a trusted messenger that the community identifies, you know, is so important.
You know, it's interesting. And that was Stan Martin with us earlier on Buffalo What's Next, along with Ebony White here today on Buffalo What's Next. That'll do it for today's program. Of course, we'll be back with you tomorrow here at 10 o'clock on member-supported WBFO and WBFO HD1 Buffalo, WOLN Olean, and WUBJ Jamestown, your NPR station.